Looking for a Bestnotes alternative? Here is the difference that decides it. Behave Health includes in-house billing, while Bestnotes appears to use third-party billing partners. When billing lives outside your EHR, your revenue cycle depends on a separate vendor relationship instead of one connected system. Bestnotes versus Behave Health. We compare these two behavioral health EHRs on utility, value, and ease of use for addiction treatment operators. We walk through the feature sets, the billing models, the human resources overlap, and where the two platforms genuinely diverge. Shopping for an addiction treatment EHR? You will likely come across both Behave Health and Bestnotes. Few sources offer a true apples-to-apples comparison. Both platforms target behavioral health and addiction treatment, and each describes its offering differently, which makes a side-by-side hard to find. Bestnotes lists documentation, CRM, calendar, billing, telehealth, outcome tracking, a patient portal, admissions, and reporting among its features. When billing runs through third-party partners and your tools live in separate systems, your team manages more vendors and more handoffs than a single platform would require. Bestnotes appears to use third-party billing partners, which means your revenue cycle sits outside the EHR you work in every day. A single platform is designed to reduce the need to manage multiple systems for clinical, admissions, and billing work. Behave Health is an all-in-one solution that delivers CRM, EHR, revenue cycle management, and ERP in one streamlined product at an accessible price point. Customer relationship management, electronic health records, revenue cycle management, and enterprise resource planning are designed to work together in a single platform. Behave Health offers a free trial account so you can try it before you commit. Based on publicly available information, Bestnotes does not appear to offer a free trial. 3 differences stand out when you compare Bestnotes and Behave Health for addiction treatment. Let us walk through each one. The billing model, the breadth of the addiction treatment feature set, and the switching path are where the choice usually gets decided. Difference 1. How billing is handled. Behave Health lets you keep your existing billing system, adopt a third-party service, or have Behave Health specialists run your entire revenue cycle. That team can handle EVOBs, utilization reviews, pre-auths, billing and collections, patient responsibility payments, claims denials, and appeals. Difference 2. The breadth of the feature set. Behave Health includes admissions and intake, EVOBs, utilization reviews, bed management, case management, and community connections. It also covers clinical assessments, treatment plans, drug testing, the MedPass workflow, medication inventory, and property management. Difference 3. How you switch. For current Bestnotes users, Behave Health handles data migration, staff training, and parallel go-live support. The migration is structured so the transition does not disrupt your operations or your revenue cycle. An honest comparison notes the overlap. In several areas, the two platforms appear comparable, based on publicly available information. Bestnotes appears to offer human resources capabilities comparable to Behave Health's, with no major differences apparent in this area. Both platforms appear to offer telehealth, outcome tracking, and patient portal features. Common reasons organizations explore Bestnotes alternatives come down to a few recurring needs. Operators often want billing without third-party integrations and a dedicated admissions CRM with lead tracking and referral analytics. Others are expanding into recovery housing or peer support, or want a single platform to reduce the systems they manage. Behave Health puts clinical, administration, staff, admissions, alumni, residents, treatment plans, billing, and insurance authorizations in one app. Billing and collections, claims denials, and appeals are designed to live inside the same platform as your clinical and admissions work. The platform includes HIPAA-aligned file storage and a mobile-first design across the addiction treatment workflow. Behave Health can also point you toward resources for licensing or accreditation through the Joint Commission or CARF. Stop running billing through a separate vendor. See the all-in-one platform with in-house billing. Book a demo at behavehealth.com. See in-house billing, the admissions CRM, and the addiction treatment feature set with a free trial at behavehealth.com.